A seizure is a sudden, uncontrolled burst of electrical disturbances in the brain, and this could produce uncomfortable symptoms in anyone who suffers it. You're welcome once again to this channel, Dr. Ayukes. I'm still Dr. Ayubola Ogunbanjo. Today, let's talk about seizures, some of the causes, the triggers, how to avoid the triggers, what to do when somebody around you is having a seizure, and some of the reasons you should visit your doctors after a seizure. But before then, kindly subscribe, like, and share this video to reach more people. So let's get to it. What is a seizure? Like I mentioned earlier, a seizure occurs when there are sudden bursts of uncontrolled electrical disturbances in the brain, which often result in certain changes, like changes in the level of consciousness, changes in movement, changes in feelings. And these changes are what produces the symptoms that you notice in anyone having a seizure. A seizure often lasts for about 3 to 5 minutes, after which it stops on its own. But when a seizure is recurrent or lasts for longer hours, that is referred to as epilepsy. But today we shall be talking majorly about seizures. So let's quickly talk about some of the causes of the seizures. Number one, brain tumor. Number two, brain infections like meningitis, encephalitis. Number three, certain medications. Number four, certain metabolic disorders. Number five, certain genetic disorders. Number six, developmental problems. Number seven, electrolyte imbalances, as seen in hyponatremia, for instance. Number eight, preeclampsia, that is often seen in pregnancy, can lead to seizure. Number nine, illicit drug use. Number 10, a stroke. Number 11, epilepsy. Number 12, a high fever, especially seen in children. Now that we have listed some of the causes of a seizure, let's talk about the triggers. What could trigger a seizure, especially when the person is already been diagnosed to have seizure or had a seizure before? Number one, skipping of medication. If you have already been diagnosed with maybe epilepsy or you've already had a seizure before, skipping of medication could predispose to having another seizure. Number two, sleep deprivation. Not getting enough sleep is another reason that seizure could be triggered. Number three, low blood sugar. Number four, extreme stress is another reason that seizure could be triggered. Number five, infections. Number six, fever. It could trigger a seizure too. Number seven, skipping of meals could trigger a seizure too. Number eight, dehydration, not getting enough water. Number nine, hormonal changes like as seen during menstruation, puberty, or menopause. Number 10, illicit drug use, like the use of cocaine and amphetamines, could trigger a seizure. Also, certain medications could trigger a seizure. Furthermore, bright light, flickering light, or flashlight could trigger a seizure. Anyway, let's learn some of the symptoms of a seizure. Number one, you could have continuous staring or glance. The person could just be staring for about 2 to 3 minutes or 4. And you might not know they're having a seizure, but if you're already conversant with that, you know that that could be a sign of a seizure, especially when they're just staring blankly without even moving for some time. Number two, continual jerky movement of the arms and legs could be a sign of a seizure going on. Number three, sudden stiffness of muscles that could predispose to a fall. Number four, difficulty in breathing is another symptom that you could see in somebody having a seizure. Number five, hallucinations, imagining things, thinking you are seeing things that are not real. Number six, repetitive movements like lip smacking. The person keeps smacking their lips or they keep chewing continuously. Number seven, continual eye blinking could also be another sign that you notice in people who are having a seizure. Number eight, loss of consciousness. Sudden loss of consciousness. Number nine, sudden fall. Sudden fall, especially when the person is having muscle stiffness, they could predispose to a fall. At times, people could have a seizure while they are sleeping. You could notice sudden jerking movements while they are sleeping. They could make loud noise from their sleep. That could also be a sign of a seizure happening while the person is sleeping. Now that you are beginning to learn some of the signs of seizure, you should be able to help somebody having a seizure around you. If you notice any of the signs, or you already know the person has been diagnosed with a seizure and you notice them having any of the signs, so do this as a first aid to help them with this seizure. And in the first aid of seizure, there are 3 S. The first S stands for stay. The second S is safe, and the third S is side. So let's talk about the first S, stay. or you notice somebody around you is having a seizure, stay calm as much as possible and ensure that other people around the person having a seizure, they are also calm. And in the process of waiting for them to get through with this seizure, do not force them to stop having the seizure. Leave them alone through the whole length of the seizure, because while you're trying to force them to stop the seizure, you could be causing danger. So just leave them alone and stay calm as much as possible. If possible, if you witness the beginning of the seizure, time the seizure to know the length, the duration of the seizure, the seconds or the minutes taken for the person to have the seizure. Number two, safe. Try as much as possible to keep the environment clear of any object that could injure them, maybe like a broken piece of glass, a wooden plank, or any other thing that could injure them. Keep their environment as safe as possible. Also, if they are wearing tight-fitted clothing, remove it. If they have eyeglasses on, remove it in order to keep them safe. Also, another thing you should do in order to keep them safe is do not put anything in their mouth while they are having the seizure. Do not put a spoon or try to press down their tongue. Do not give them water or food until they have totally recovered from that seizure. And lastly, side. Keep them on the side. When somebody is having a seizure and you've noticed, try to prevent them from having a fall. So keep them on the ground, on their side, so that they do not swallow their saliva and block their airways. So keep them on the side. Put a cushion over their head, like a soft pillow or a soft cloth, in order for them to be comfortable. So leave them on their side throughout the duration of the seizure without trying to move them. The only time you could try to move them is they are around impending danger. Maybe they are around a broken glass, a wooden plank, or an iron or something that could harm them. So just try to move them slightly, not with force. Or another time you could also move a person having a seizure is when they are having the seizure inside water. Take them out of the water as soon as possible and lay them on the ground on their side with a cushion over their head. And then once they recover from the seizure, try to sit them in a safe place. Make sure they are totally recovered, they are able to communicate, they are aware of their environment, and reassure them. You could explain to them what just happened to them in a very calm and reassuring manner. Reassure them and let them know that they are fine. If they want to sleep, allow them to sleep, and make sure you are watching out for their breathing while they sleep. However, if you notice these things in somebody that have just had a seizure, you should consult your doctors as soon as possible. Number one, if the seizure lasts for more than 5 minutes, you should consult your doctors. If you have the emergency response number of your locality or your country, you could call immediately. If you do not have it, then start going to the nearest hospital to you. Number two, if they are having difficulty in breathing, that's another reason to start going to the hospital. Number three, if that's the first time they've ever had that seizure, it's a reason to visit your doctor's office immediately. Number four, if they have another seizure after the first seizure, let's say the first seizure stopped after 4 to 5 minutes, and then within a few minutes they have another seizure, then you should take them to the hospital immediately. If they are unresponsive after a seizure, for a long time after a seizure, they've lost consciousness for a long period of time, then you should visit your doctors immediately. I forgot to mention that while somebody is having a seizure and you're trying to help them, do not do CPR. Now, lastly, let's talk about how to avoid or limit the seizure from occurring. And basically, that we have to do with limiting the triggers. We've already mentioned all the triggers. So then, limit the consumption of alcohol. Number two, do not skip medications. Number three, avoid illicit drug use like cocaine, amphetamines. Number four, stay hydrated and drink a lot of water to prevent dehydration. Number five, do not skip meals so that you avoid your blood sugar from dropping. Number six, get quality sleep. Make sure you do not deprive yourself of sleep. Number seven, limit or avoid stress as much as possible. And number eight, always speak to your doctors. If you've been diagnosed with a seizure and you often have an aura before it, it's good you quickly take your medications to avoid the seizure from occurring. I hope you have been able to learn something about seizure and how to help somebody who has a seizure and some of the causes and triggers. Thanks for watching once again. Do not forget to subscribe, like, and share this video to reach more people. Till next time, Dr. Ayo truly cares about you. Bye.